Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. Welcome, so glad to have you. In today's episode, we're going to talk about calculus detection. Calculus detection is one of those really challenging skills that are hard to develop. And it takes you the entire time that you are enrolled in school to get really good at calculus detection. So in this episode, we're just going to talk about some of the tips and tricks that will help you be more successful and maybe mastering calculus detection a little earlier during your journey through the program. One of the things that you do in Clinic 1 in skill development is learning how to use your instruments. And the Explorer 1112, also known as the pigtail, is one of the instruments that you will learn to use in order to detect calculus. Remember, the gums wrap around each tooth like a little turtleneck, and then they attach to the tooth. And there's a little space between what we call the gingival margin and the base of the pocket. We measure that space with our periodontal probe. We explore that space with our 1112 Pigtail Explorer. This is where the calculus resides. The calculus can also reside above the gingival margin, above the gum line on the tooth, and that is easily visible to you with your loupes. The calculus that's hard to discover and difficult to find and detect is the calculus that is below the gingival margin, below the gum line, that resides in that little natural occurring pocket that resides around each tooth. Now, here's the first thing to know. Patients do not know about that little space, about that tissue, about that pocket, that naturally occurring pocket that is around each of their teeth. They do not know that you are going below the gingival margin with a probe, never mind with sharp-bladed instruments. And it's probably important that we leave that to the professionals to know. So one of the things that I'd like to share with you is that you will learn about your grasp and how you hold the instrument. And I would say that most students suffer from the scared mindset of I'm going to hurt my patient, because most of the instruments that we use look really sharp and pointy. But I promise you, as you also learn the skills of adapting your instrument, learning the line angles and the anatomy of the tooth, you will get better and better at adapting that instrument and finding and feeling calculus. So one of the things I'd like to share is that when you do the assessment, you do the gingival assessment before you do any instrumentation down below that gingival margin. When you are doing your gingival assessment, the tissue tells you a story about what is going on in general with the dentition. Oftentimes, students miss connecting the dots between what that gingival assessment means, what it's telling us, and how that relates to calculus detection. So this is what I'm here to share. If you look at the tissue, and the tissue, now picture beautiful, healthy tissue that you see in your textbooks, that really knife edge tissue. Maybe some of your classmates have that type of tissue and you've worked on one another, so you know what I'm talking about. That hard to probe tissue because it's so knife edge that you can't get your probe between the tooth and the gingival margin to actually gently glide down along the tooth to the base of the pocket. That is what we're looking for, that really tightly bound tissue around each tooth. If the tissue is not that, if you have rolled margins, irritated tissue, swollen bulbous tissue, there's a reason for that. And it might just be soft tissue deposits, but oftentimes there's calculus involved in those situations. So I want you to try to connect the dots between your gingival assessment and your calculus detection. When you do your calculus detection in clinic, go back and look at your gingival assessment and see if you noted any irritated or red bulbous regions with your gingival assessment. Did you note that there was calculus in those regions as well? Is there a correlation between your gingival assessment and your calculus detection? There should be. And if there's not, lighten up your grasp and check the area again. What I will say is, as far as connecting the dots between the gingival assessment and the calculus detection, is oftentimes if there's if there's tissue in the interdental papilla is really swollen or bulbous, there usually is calculus present in that interproximal space. And the reason why you're not feeling it is because you're not reaching into the caul area enough with the tip of your explorer, or you're not lightening up your grasp enough to find and feel that calculus. So once you've done your calc detection, look back at your gingival assessment. See what your notes say in your gingival assessment as far as areas that might be suspicious to you. Then go back and check again. Only this time you're going to have a very intentional light grasp to find and feel that calculus. You'll be surprised. You'll probably find calculus once you connect the dots between your gingival assessment and your calculus detection. The tissue always tells us a story. The other thing that's really challenging when you're first learning calc detection is root anatomy. This is where your oral anatomy skills come in. There's lots of root concavities, and sometimes it's hard to depict whether or not you're feeling the CEJ, rough cementum, a root concavity, or actually feeling calculus. Maybe there's a restoration that goes in between the teeth, and that also is hard for you because the margin of the restoration might be tripping you up a little bit. Use your radiographs as well to help you. Your radiographs are an important tool to really help you uncover and discover what it is you could be feeling in that area. Now, it'd be really easy to tell you that the calculus is on the radiographs. That doesn't always tell you. Sometimes you'll see the calculus on the radiographs, and boy, does that make our job a lot easier for sure, but not always. So when you are doing your calculus detection and you find and feel something that you're not sure is calculus, look at the radiographs and see if you can discover something on the radiographs that you might be feeling. I promise you, if you use your radiographs to help you with understanding the root concavities, or if there's furcation involvement and what might be causing you to feel something abnormal in that area, it will go a long way at helping you be more accurate with your calculus detection. And don't underestimate the importance of your grasp and how you roll around the line angles. You know what's a real stinker about calculus? It's usually in the most complicated areas for us, right on the line angles, right on the line angles and deep in the interproximal space of the caul regions. And those can sometimes be the most challenging areas for us to detect. You have to slow down your strokes and shorten up your strokes when you go around the line angles. And I tell students, it's like driving a car. You have to slow down to go around a corner. Or what are you going to do? You're going to lose control and end up in the ditch. You have to slow down your strokes, shorten up your strokes when you go around the line angle to find and feel calculus, or you're going to miss the calculus that's on the line angle. And in the caul area, you have to reach into the caul with your instrument. And I find that students have a harder time reaching into the caul because it looks really scary in the caul area. You feel like your instrument is too far subgingival and that you might be hurting your patient. But trust me, with a little bit of practice and confidence and using your radiographs and all of your instrumentation skills, you will develop the confidence you need to reach in there and find the calculus. The other thing, going back to form and function, remember that the embrasure spaces are larger on the lingual aspects of the teeth because of the location of the contact area and the shape of the anatomical crown. It's important for you to know that when you are exploring, if you can't feel it in the call area from the facial or buccal aspect, go ahead and try from the lingual aspect of the tooth and see if that helps you make that distinction of whether or not there's calculus present. We suffer from not having the ability to see on the lingual areas, and we have to use indirect vision or we have to do retraction of the tongue. But I promise you, from an anatomy standpoint, there is more space on the lingual aspect of the dentition. So go ahead and use that to your advantage when you are trying to detect calculus around the mouth. Don't give up. This is a skill that takes a long time to establish, and most of it comes from your confidence and connecting the dots between all of your early classes, things like your oral anatomy class, your radiology class, all of the fundamental instrumentation that you learn in Clinic 1, and then the gingival assessment. Sometimes it's hard to say, oh, that's right, that dot needed to be connected to that dot in order for me to make an understanding. So use all of the different parts of the assessment as you gather that information to help you truly understand whether or not you are detecting and finding and feeling calculus. As you develop that skill, you'll be able to detect calculus and not even think twice about it. I promise you this skill will develop. Thank you guys for listening. I really hope that you're doing well on your journey to becoming a hygienist. Reach out to me if there's any content that you need further clarification or for me to cover. That's what I'm here to do, to help you with all of the little parts and pieces of dental hygiene school so that you can be successful and get those initials at the end of your name. Have a great week. I'll talk to you soon.